Today, we're talking about something that starts with a feeling most of us know all too well: back pain. But this isn't your everyday ache. This is about a rare and really serious condition where knowing the signs isn't just good information, it can literally change your life. So let's dive in.
Right? We all get it. A tweak in a lower back, an ache after a long day. And usually, we just stretch it out, maybe take a pain reliever, and it gets better. But what if it doesn't? When does that familiar pain cross the line from being just a nuisance into a full blown, time sensitive medical crisis?
Well, that's where something called Cauda equina syndrome, or CES, comes in. Basically, it's a condition where the bundle of nerves at the very bottom of your spine gets crushed. And I want to be crystal clear about this right from the start. This is a true medical emergency. This is not something you sleep on.
Okay, so to really get what's going wrong here, we have to take a quick look at the anatomy. And believe it or not, the name Cauda equina actually gives us a huge clue. Cauda equina. It's Latin for horse's tail. And that's because this bundle of nerves dangling from the end of your spinal cord looks just like one. And these aren't just any old nerves. Oh no. These are the critical communication lines that control everything in your lower body. Your legs, your bladder, your bowels. Yeah, pretty important stuff. So if that horse's tail gets squeezed, how on earth would you know? This brings us to the absolute most important part of this whole discussion, the red flag symptoms. These are the signs that you just cannot afford to ignore. Okay, there are a few major warning signs to be on the lookout for. First up, any weird changes with your bladder or bowel function. Like having trouble starting to pee, or maybe not even feeling the need to go, or even worse, losing control. Second, and this is a big one, is something called saddle anesthesia. It's a very specific kind of numbness. Think about any part of your body that would touch a horse's saddle. If that area goes numb or gets tingly, that's a huge red flag. And third, severe sciatica, that shooting nerve pain, but this time it's going down both of your legs, and it's often paired with some serious weakness. A sudden change in sexual function can also be a critical sign. Now look, any one of these symptoms is definitely worth getting checked out, but it's the combination of them that really screams emergency. So if you've got bad back pain, plus that saddle numbness, and things are getting weird with your bladder, that's a massive warning sign that those nerves are in deep, deep trouble. I'm going to say this again because it is that important. If you are experiencing this cluster of symptoms, this is not the time to wait and see. This is not the time to book a doctor's appointment for next Tuesday. All right, so what is actually causing this dangerous pressure on the nerves? For that, we've got to peek inside the spine itself. The number one cause by a long shot is a massive disc herniation in your lower back. So think of the discs between your vertebrae as little jelly donuts. Well, in a massive herniation, that donut basically explodes, and a huge glob of that jelly filling squishes out right into the spinal canal and lands directly on top of the cauda equina nerves. That physical pressure just crushes them, completely blocking the signals trying to get from your brain down to your lower body. Now, while a herniated disc is the usual suspect, it's not the only thing that can do this. Other things like a severe narrowing of the spinal canal, a tumor, a bad injury to your back, a nasty infection, even in rare cases, complications from a past surgery can all cause that same catastrophic compression. And that brings us to the urgency of all this. With Cauda equina syndrome, the clock starts ticking the second those symptoms appear. This isn't just about managing pain anymore. This is about saving function. It is a true race against time. And here is the number you need to remember: 48. The general medical consensus is that you have about 48 hours from when the severe symptoms start to get surgery. And why? Because when those nerves are being squeezed, they're not getting blood, they're not getting oxygen. Waiting too long means those nerves can start to die. Acting inside that 48-hour window gives doctors the best shot at preventing permanent paralysis and other lifelong problems. So let's just make this dead simple. If you experience that trifecta of red flags, the saddle numbness, the bladder and bowel changes, the severe weakness in both legs, then you must go to the emergency room immediately. No waiting, no calling for an appointment. You go straight to the ER. And the whole point of that emergency visit is to get a quick diagnosis, usually from an MRI, and then get you into emergency surgery. The entire goal of that operation is just one thing: decompression.
The surgeon's job is to get in there and physically remove whatever is crushing those nerves, the disc material, a bone fragment, whatever it is, and just give those nerves some breathing room so they have a chance to heal. But what happens after that surgery? Relieving the pressure is a huge first step, but for many people, it's really just the beginning of a very, very long road. The road to recovery is a marathon, not a sprint. For sure. After the surgery and a hospital stay, patients are often looking at months of really intensive physical therapy and rehab. And long term, it's all about learning how to manage whatever issues might be left over. And this is exactly why that 48-hour window is so critical. Because even with a perfectly successful surgery, some of the nerve damage can be permanent. Patients can be left with lifelong challenges, bladder and bowel problems, chronic pain, weakness or numbness in their legs, and of course the huge psychological impact that comes from an event that just changes your life in an instant.
So we started with a pretty simple question. When is back pain more than just back pain? And now you know the answer. You know the red flags to watch for. So the final question really is for you. Now that you know the signs, could you spot the emergency? And could you act in time?